For my career project, I did athletic training, and this is my brochure, and I'll go through this first. So a few things I learned about athletic training is, first of all, what do they do? Certified athletic trainers are medical experts in preventing, recognizing, and managing and rehabilitating injuries that recover from physical activity. Athletic trainers can help you avoid unnecessary medical treatment and disruption of normal daily life. If you're injured, they can get you on the mend and keep you on the move. Athletic training is recognized by the American Medical Association as an allied healthcare profession, and the AMA recommends certified athletic trainers in every school to keep America's youth safe and healthy. The certified athletic trainer specializes in 6 practice areas or domains: prevention, clinical evaluation and diagnosis, immediate care, treatment, rehab, and reconditioning, organization and administration, and professional responsibility. A certified athletic trainer's day may look like preparing athletes for practice or competition. That could include taping, bandaging, bracing, just like preparation for practice and games. They evaluate injuries to determine their management and possible referral. They develop conditioning programs that help athletes, and they can implement treatment and rehab programs as well. These duties require extensive knowledge, as you'll see when you see their school requirements, and strong decision-making skills obtained through their experience and education. Other stuff in my brochure would be basically what education does a certified athletic trainer need in order to be one. Students who want to become a certified athletic trainer must earn a degree from an accredited athletic training curriculum or meet other requirements set by the Board of Certification, or BOC. A growing number of universities are gaining accreditation through the Commission of Accreditation of Athletic Training. The entry-level education programs include formal instruction in a variety of areas. A few of them are injury, first aid and emergency, assessment of injury and illness, human anatomy and physiology, therapeutic modalities, and nutrition. What are the qualifications? Graduation from an accredited athletic training education program. After you're interested, candidates have to meet the curriculum requirements. They must pass an exam administered by the BOC, and then those who pass, they continue their education requirements set by the BOC, and they record their units back to the BOC at least once in each 3-year term. And submission of annual BOC certification fee or payment of NATA annual dues. Where does a certified athletic trainer work? Certified athletic trainers can be found almost anywhere where people are physically active, whether it's on the playing field or in an industrial work setting. Certified athletic trainers are in place to develop active people, prevent injuries, and stay healthy. Here are some of the places you will find them. Secondary schools. Public and private secondary schools offer abundant job opportunities for certified athletic trainers. Parents and administrators are also discovering the benefits a certified athletic trainer can offer in preventing and caring for injuries. Many certified athletic trainers teach classes at the high school level. The American Medical Association recognizes athletic training as an allied health care profession and recommends certified athletic trainers be in every high school. You might find them in colleges or universities. Certified athletic training jobs in colleges and universities generally fall into 2 categories: athletic department staff assignment and combination teacher/athletic training. You may find them in professional sports. Although teams operate only a few months per year, certified athletic trainers work year-round conditioning and rehabilitating athletes. Fewer jobs are available in this practice setting due to the limited number of teams. You may find them in sports medicine clinics. This growing setting provides certified athletic trainers the opportunity to work with a number of different healthcare professionals and a diverse patient population. In addition to athletic injury rehabilitation, many clinics also provide athletic training services for secondary schools via outreach programs. You may find them in the military. Each branch of the U.S. military is increasing its use of athletic trainers. Certified athletic trainers can be found as part of the healthcare team for active duty, injured service people, on and off base fitness and wellness centers, new recruit readiness programs, and pre-enlisted readiness programs, in addition to established military school sports teams. Lastly, industrial and commercial. These settings utilize both outreach clinics and full-time certified athlete trainers to deliver services. Athletic trainers are a key component to the healthcare team and work with physicians and other allied health personnel. Certified athletic trainers are first responder medical personnel who are experts in injury assessment and treatment, particularly in the orthopedic and musculoskeletal disciplines. And lastly, I just talk about the National Athletic Trainers Association and just like basically what that is. So now I'll go through my poster. I have a picture of GU's training room as well as my old coach in the pool. So it's just a form of rehab that an athletic trainer might advise. Water aerobics. I have a picture of kids, a team doing strength training. A picture of a trainer taping someone's ankle, probably like before a game. I also have a picture of ankle stability, and when I broke my ankle, I had to do this as well, and it's basically like a foam box, and you have to stand on it and toss the ball back and forth, and it helps just like stabilize your ankle. So I thought that was interesting since I had to do that as well. Salary information. The 2010 reported median wage for an athletic trainer is around $41,600. Of the industries that employed the most athletic trainers, elementary and secondary schools were among the highest paying. Many athletic trainers receive benefits and reimbursement for continuing education costs. So that's what you might see if you were an athletic trainer payment-wise. What are the qualifications to become an athletic trainer? I already went over that in my brochure. What does an athletic trainer do? Athletic trainers are classified as allied health professionals. They are degreed professionals and must be licensed in most states. Their jobs involve efforts to prevent, assess, treat, and rehab various types of injuries that might result from participating in sport or exercising. And then I went over where they work already. But basically, I was lucky enough to have this career choice as an open one that I could pick, but I also want to be an athletic trainer or something along the lines of that. So I thought this project was really interesting. The last thing I have is a video, and it's basically just a bunch of professionals talking about how they feel athletic training is super important. And I thought that everything they said was pretty valid, so I thought I would just play a short clip of that here, Deb. So here's the video. Really quick.
Having certified athletic trainers work with us from a physician standpoint is crucial to what we do, both with athletes as well as in the clinic.
The athletic trainer kind of represents a grassroots, actually, where the rubber meets the road aspect of healthcare. They're usually the first one to triage an injury and also the one that gains that initial trust of a client.
My dealings with certified athletic trainers are literally all day, almost every day. So it's a pretty intimate relationship with these guys and girls, and we work well together. They're a vital part of what I do in my sports practice.
Certified athletic trainers are healthcare professionals, and they see the student athlete or the patient every single day, whereas I may come in 2-3 afternoons. I don't get to see them every single day, just as any patient that I would see in my practice.
The athletic trainer provides the insights that usually bridges the gaps between basic primary health care and sport and physical activity.
Certified athletic trainers have great orthopedic musculoskeletal education. They often know just as much as many of our more established providers in medicine.
The key to athletic trainers is really the hands-on experience, and it's something that's critical. And I think a lot of other curriculums have lost sight of the fact that you can learn in a textbook and you can learn in a classroom, but unless you apply it, it's very difficult to marry the education to what needs to happen on the field. And I think the athletic trainers have kept that in their curriculum.
I think that the training that they have to come out and do the things that they do, both from a practical standpoint and from an academic classroom standpoint, is as good as you can get.
I still think that the certified athletic trainer is the point person, the first person out to evaluate the athlete.
People look at them as taking care of sports-related injuries. And I think what they miss a lot of times is that the certified athletic trainers are often the counselors for the athletes as well.
The athletic trainer doesn't care how skilled an individual is. They don't care what the score or the outcome of the sporting event is. They're always focused on making sure that the individuals who participate are receiving the highest quality care and follow-up treatment if necessary.